All right, everyone. Thank you for coming. This class that we teach here is basically intended to do the following. We talk about how the spine gets misaligned in these certain ways, how these misalignments affect our health right now, and how our unique methods actually address fixing these things. So I want to tell you a little bit about myself first before we get started. My name is Dr. Todd Pickman. I moved here about 3 months ago with my wife from Albuquerque, New Mexico. The way that we got started in chiropractic, or I should say my own personal chiropractic experience, my own history, I just wanted to share my own personal chiropractic history as far as how I got into chiropractic, how I was exposed to it. When I was in second grade, I was playing kickball and I slid into third base. And when I slid into third base, a friend of mine fell on my head. I woke up the next morning and I couldn't move. So I'm in second grade and I couldn't actually move my neck. So my parents did what they knew to do, and they took me to actually see my mom's orthopedist. And he gave me painkillers and muscle relaxers, and the pain started to go away. And that was the last that we kind of dealt with it. So then what happened is several years later, when I was in sixth grade, I basically had something similar happen where I woke up one day and I couldn't move my neck. And now I was starting to get a little bit of pain into my arm. We did the same thing. We went back and I actually saw the same orthopedist, and I got painkillers and muscle relaxers, and then we didn't think about it again. So fast forward to 17 years old. Okay, so I'm getting ready to getting pretty close to graduating high school, trying to figure out what I wanted to do with my life. And I'm in the gym working out, and I'm doing squats. So I have a bar across my upper back, and I feel something crunch in my upper back. I didn't really think much of it, but that next morning, same thing, I wake up and I couldn't really move. But now my arm was actually on fire, and I was having burning pain down my arm, and it hurt anytime I lifted my arm past about right here. So I'm thinking, okay, I'm 17 years old. I thought I was pretty healthy, and now I'm having this crisis. So I went in and saw a orthopedist, because that's what I thought I should do. And they recommended that I do physical therapy, and I started doing physical therapy, and I did this for a couple months. And as I'm going through physical therapy, I'm thinking, wow, this is pretty cool. Maybe this is something I want to do for a living. Well, it didn't really help me. Helped me about maybe 10%. And so with that, I started having different thoughts. And I discontinued doing physical therapy after a couple months, and I forced myself to start working out in the gym again in pain. So I'm back in the gym and I'm lifting weights, and I didn't know anything about chiropractic. And there was a personal trainer there, and he told me, he said, you need to go see my chiropractor. The only thing I knew about chiropractic was that I used to make fun of chiropractors because a girlfriend of mine used to see chiropractors, and we used to say that she was going to see this voodoo witch doctor. All right, and we had no clue what was going on or the whole purpose behind it, but my friends and I used to make fun of my girlfriend for going to this chiropractor. That's my only history of chiropractic up until this point. So anyway, this personal trainer tells me to see his chiropractor, and I'm so desperate at this point because I'm 17 years old. I've been hurting now for several months. I'm feeling like I'm actually disabled, and I'm thinking, what are my options? Should I go and have someone actually cut on my spine? And I remember visualizing and thinking that I might actually need surgery because I was having such significant pain and issues in my arm. So anyway, he tells me to go see the chiropractor, and I said, you know what? At this point, I'll go see a witch doctor. I'll go do voodoo if that's going to help me. I go see this chiropractor. He takes x-rays of me, shows me where my spine's out of alignment, and he starts adjusting me. And literally within 2 visits, I'm 90% better, okay? And I feel like I just got my whole life back. So at that moment, I knew that I was going to devote my entire life to spreading this message and to teaching others about this little secret of chiropractic that I knew nothing about until the age of 17. So that kind of brings me up to speed with this. We moved out here a couple months ago. I was in practice in Albuquerque for 9 years. And some highlights of this clinic and some of the reasons that we came out here is basically we partnered up with Dr. Deed and Dr. Shirlene Harrison to build the world's largest chiropractic corrective care facility. And for some of you that we've already explained that to, you may understand what that is. but that's what we're going to focus on tonight, is talking about how we are so unique and different. So some key points about our facility. This is an 11,000 square foot facility. It's the largest corrective care facility on the whole planet. Basically, this room that we're sitting in right now, this is called the CBP Doctor Institute. The technique that we specialize in here is called CBP, stands for Chiropractic Biophysics, and this is actually a training facility for other doctors. Our first seminar this year will be December 7th through 9th, where we'll have anywhere between 50 to 100 chiropractors come and attend seminars here in this room, and we actually teach them these unique methods. So, largest power plate training facility west of the Rocky Mountains. The room behind me over here, there's all these different machines in there. They're called power plates. It's a full body vibration. It's used for types of spine rehab and also exercise. I'm going to mention this and talk about it towards the end of the presentation. And the last thing is our clinic director here is Dr. Dean Harrison. He's the most published researcher in the entire chiropractic profession. Chiropractic has, unfortunately, a lack of research across the board. And Dr. Dean and his late father, Dr. Don Harrison, devoted their entire lives to really researching and helping provide proof and evidence of what exactly chiropractic does and can do. So in the back of this room, there's a library, there's different books in here, there's a whole bunch of spine journals and just various chiropractic and orthopedic journals that this work has been published in. On this back wall over here, there's a handful of kind of published articles. So at the end of this, you guys should go up and just kind of check it out. You'll notice that the first name on a lot of these are either Dean Harrison or Don Harrison. So a really cool part about what we do here, and a reason I was so excited to come join this, is that this is the most evidence-based system of conservative spinal correction on the planet, non-surgical correction. Most evidence-based, meaning we have research to back up every claim that we make. So, is that significant? Is that important? Sure. Yeah. And also, I'm going to make this audience participation. All right. So let's just start off kind of talking about the current state of affairs in our country as far as health. So, in a study of over 191 healthcare systems of all the major industrialized countries, so all the developed countries. They did this study and they found that we're #1 in crisis care. So what does that mean? That means that if you're in a roll-over car accident and you have blood coming out of your ears, this is the best place for it to happen. Okay, get rushed to the emergency room. We have the best emergency crisis care setups in the whole world. Your chances of surviving a trauma in the United States are better than anywhere else in the world. Okay, so we're #1 there. But we're ranked 37th in healthcare. So what does that mean? That means that overall health outcomes, markers, as far as different disease processes and so forth, we're very, very low on the list. Is that a problem? Okay, so now, and this is the part that I think is really interesting, is that we have the most expensive healthcare system in the world. So we spend more on our healthcare than anyone else, yet we're 37th in overall health outcome marker. So this is from World Health Organization. This is a report in 2000. So I have some more recent stats here. In 2011, we spent $2.7 trillion on healthcare, ranked 34th in life expectancy. So 26 in infant mortality. So that means that there's several other developed nations that have a better chance of an infant surviving childbirth than here in the U.S. Right? Isn't that kind of surprising? So different studies show kind of various numbers, but it's around 30 to 40% of deliveries are still done with either forceps or vacuum extraction, which there's an extreme amount of suction or traction pull on the head. That's one of the things that contributes to problems with infant mortality. And then going down here, 20 to 30% of patients receive contraindicated care. So that means in hospitals, that means going and visiting their doctors and getting maybe medications that weren't appropriate. So now, out of 13 countries, we're number 12. So again, this is a different type of study looking at the same thing, showing that we're ranking pretty low as far as overall health. And so we'll get to the meat of this. Perhaps the word healthcare has given us the illusion that medicine is about health. And really, we like to refer to our healthcare system, unfortunately, as more of a sick care model. Most of us are taught that you go and you see a doctor when you have a problem. But if you don't have a problem, you don't do anything. And it's starting to change. People are a little more aware now of going in and getting yearly blood work and getting physicals and that sort of thing. But unfortunately, most Americans go and see a doctor when they have a symptom, and not as a preventative, proactive type of approach. So there's 3 major diseases that we die from in this country. All right, it says 3 major diseases. I should say 3 major causes. All right, 2 of them are diseases. Can anyone guess what number 1 is?
Heart disease.
Okay, heart disease is number 1. Heart disease is number 1. Who knows what number 2 is? Cancer. Okay. And then number 3, I'm not even going to make you guess it because you're not going to guess it, so I'll just show you. Heart disease, this is in 2006, over 800,000 die a year, 34%, so let's make that kind of hit home. How many people do we have in here? 1, 2, 3, 4, 5, 6, 7, 8. So there's 8 of us, so let's say 1 out of every 3. So that's about 3 of us in this room statistically are going to die of heart disease. Who here doesn't want to be one of those 3? Okay, right? That's a good yes or yes question. All right. The second one, you guys got this right, is cancer. And cancer kills about 600,000 people a year now. Okay, this is kind of an older stat. 1 out of every 4. So we said 3 people are going to die of heart disease, and now 1 out of every 4. So that makes about another 2 of us. So that's 5 of us. That's assuming that you're not going to have heart disease and cancer at the same time. So basically, in 2008, an average of 1,500 Americans died every single day from cancer. So that's pretty significant. That's several jumbo jets going down every single day. Now, number 3, this is always the shocker, is medical care. And now, something I just want to just kind of clarify before going through this is our position is not that we are anti-medicine, okay? That's the furthest from it. We are for appropriate medicine and appropriate intervention whenever it is deemed fit. But the problem is that these numbers, and I'm going to show you at the very bottom, this is what medicine is kind of saying about itself. So these are stats that are basically recorded by medical professionals who are criticizing their own profession. And this is stuff that if you do a search online, you can find this. It's pretty shocking. This was shocking for me to learn initially when putting this presentation together. But 250,000 die every year. And now let's kind of break it down. 20 to 30% receive inappropriate contraindicated care. That's what we kind of talked about earlier. 106,000 die from negative effects of drugs. So 80,000 die from infections in hospitals. So typically avoiding hospitals is a good idea. Okay, if you don't need to go into a hospital, you should try to avoid going into a hospital. Usually there's different bacteria and viruses in there that you're not going to see in many other types of environments. 12,000 die to unnecessary surgeries, 7,000 from medical errors. And so these are all stats that are taken by a guy named Dr. Stanfield, MD. This was back in 2000, so all of these numbers actually have continued to rise. There's a really interesting study that's done as well, where what they've done is they take basically our current life expectancy and health, and they say if we draw a line right here, this is our current life expectancy and health. And then what happens is if we add medicine, we have this whole group of people that will be saved by medical intervention, okay? So, and then what they show in the same study is they show that this whole group right here will actually die from side effects and unnecessary surgeries and that sort of thing from medicine. And what they show in this study is that if you eliminated medicine completely, these two would cancel each other out, and the overall life expectancy in healthcare would still actually flatline and plateau and be straight across. This is actually a study done out of New England, I believe. Of course, that's not something that we're promoting because all the crisis care and all the trauma intervention is huge. But it's just interesting to look at that and say, okay, there's all these people that are helped, but there's all these people that are also harmed. Unfortunately, it's a system that has some flaws. So now, as grim as this is, very few of these things are actually recorded, so likely it's a little higher. So what I like to do is talk about some of the solutions and not just talk about all the problems. Now health, overall health, we look at it as three main things. Let's see if someone can give me one component of what it takes to stay healthy.
Water.
Okay.
Nutrition.
Okay, so diet.
Yeah.
Okay, so diet is one.
Exercise.
Exercise. And then the third one, again, I don't expect you guys to guess it because that's what we're going to talk about today, is a proper functioning nervous system. So diet, exercise, proper functioning nervous system. It's like a three-legged stool. And if you remove one of those legs, what happens to the stool? It falls over. So someone could have perfect diet, perfect exercise, and their spine is a mess, their nervous system's shut down. Basically, the brain can't communicate to the organs properly, and unfortunately, their health is only going to be as good as their nervous system allows. And vice versa, you can have a perfect spine and someone has a horrible diet and lack of exercise, they're not going to be very healthy either, are they? Okay, so what is the life source and health of our body? The life source. Now, all these communication processes that occur in the body, how does that communicate? It happens over what type of system? I know this is a really open question, so it might be tough to... Okay, so the nerve system, and nerves communicate through what way? Okay, but breaking it down here, I'm going to give you a hint.
Electricity.
There you go, you got it. So it's a electrical system, all right? So all these systems in our body, all these organs, they actually communicate through the nerves, and it's a electrical process. So it's electricity. Now, the interesting thing is that there's all these different bodily systems, circulatory system, digestive system. The nerve system is the only one fully encased in bone. Why do you think that is?
It's very fragile.
Okay, it's fragile and it's very important. So, did you know that if someone goes through hypothermia, that as blood leaves different parts of the body, it leaves the fingertips first, so the distal extremities first, right? And then it leaves the extremities completely. Okay, and then if someone's really in bad shape, they'll have no blood in their arms and legs at all, and it shunts all the blood to their torso to keep organs healthy. But then after that, do you know where the blood goes after it leaves the organs? Okay, but prior to that, what it does is it actually hangs out in the spine. Hangs out in the spine and in the brain. And then very last what it'll do is distally at the very bottom of the spine, it'll start cutting off blood supply until the brain checks out last. And the reason that is because nothing can function without the nerve system functioning. That's how important it is. It's encased in bone, just like you guys said, for basically protection and because it's a very fragile system. So now, who here has seen a chart like this before? Okay, everyone, good. This is what's called the autonomic nervous system. It is not a chiropractic specific chart. This is how we're all wired. So it's showing the spine up here, the brain sends energy down through the spinal cord, and then it comes out through these nerves and controls every cell, tissue, and organ in the body. So these organs out here are completely dependent on the energy from the brain to stay healthy. And keep in mind, I'm saying energy, and I'm not saying that to be metaphysical, but I'm saying it because electricity is energy. If you want to call it energy or messages or signals or communication, I think energy is a word that really sums it up because that's what it is. It's energy flowing both directions. And on that previous slide that I skipped over, it happens 270 times, it travels 270 times, it travels 270 miles per hour. Okay, so there's this really, really rapid process happening. And there's anywhere between 80 to 100 quadrillion cells in the body. So that's a lot of zeros. So there's all these cells, nerves control every single cell, it's happening every second. Right now we're sitting here and you guys can focus on this lecture and learn about this, and you don't have to be concentrating on your heart beating. You don't have to concentrate on your lungs working or your food being broken down and digested. I mean, who's happy that you don't have to focus on that stuff, right? Okay, I'm pretty happy about that too. So all those processes, they're happening involuntarily by the autonomic nervous system. So these nerves, these wires are controlling all those organs as we sit here right now. So now, the spine is really the core strength and health of our entire body because it houses our central nervous system. There's normal curves that we're supposed to have in our spine, and these normal curves actually equal a stronger structure, but also it allows the spinal cord to be in the most relaxed, properly functioning position. And I'm going to talk about this in just a second, because before you understand what abnormal is, what do you have to first know? What's normal, right? So let's talk about normal real quick. All right? So on the side view, the ear should line up over the shoulder, should line up over the hip, the outside of the knee, and then the outside of the ankle. All right? So if someone comes forward like this, technically that is abnormal, right? Okay? If someone is translated back like this, that's also abnormal. Okay? So that's on the side view. Now on the front view, a lot of us know that it should be straight up and down. All right? So we look at the center of the upper lip. We look at the episternal notch. Okay, and then we divide a line going down here, the center of the pubic symphysis, and then right between both feet. Should be straight up and down. All right? If someone has a big curvature in their spine, what's that called? Abnormal. And scoliosis. And a scoliosis, okay, or it could be. Or someone could have a translation where they're shifted over. That's something that I'm going to show here, is what's called a trunk translation. So now on the side view here, this is showing, it's breaking down kind of what happens between these points, because in between those points you can see that it lines up. But we're concerned with what's going on in the spine in between those points. There's certain curves you're supposed to have on the side view. This is news to a whole lot of people, that it should be straight this way, and there actually should be curves on the side view. So now there's a forward curve in the lower back, a backward curve here, and a forward curve in the neck. That model right there, not the blonde model, but the model, okay, is called the ideal spine model, also called the Harrison spine model, named after Dr. Deed and his late father, Dr. Don Harrison. So this is an actual published model, accepted and used in many different professions. But this is something that our group actually contributed to the chiropractic profession and to the world. This ideal normal. And so that ideal normal is not just a pretty line that we put on someone's x-ray, but it's actually a goal. Meaning if someone is abnormal, the goal is to get them as close to that as possible. Now, it changes for different heights of the column. So if someone's 5'2" versus 7'4", there's going to be a little variation. But it's set for the overall height, so it's mapped for that person individually. And then there's some also other factors as far as different types of pelvic abnormalities that change the model a little bit. But for the most part, it's as accurate of a representation of what the normal side view of the spine should look like. It's the most accurate thing out there in any spine profession. So now, who's heard of this thing before, a subluxation? Okay, so a subluxation is this. Chiropractors use this word. It's this big word. We talk about it a little bit, but we like to use words that people remember. So we talk about abnormal, or we talk about abnormal posture, because everyone hears about posture. But a subluxation initially in the chiropractic profession was talking about one bone shifting out of alignment in comparison to the bone below it or above it. Okay, so it was a one bone type of thing. And then what happens when that bone moves out of place? It causes pressure on the nerve, okay? So technically, compressive neuropathology, which is when the nerve is physically compressed, happens less than 10% of the time. So nerves don't actually really get compressed unless it's really, really significant. But what happens when the bone misaligns is it can do a handful of things. It can cause the disc in between to swell, and it can cause a herniated disc, which can cause compression to tissues, which ultimately disrupts the nerve. But really, it changes mechanical signals, things called mechanoreceptors, and it's a feedback mechanism in the brain. So it alters that communication process, and that can break down nerve function. I'm not going to get into all the details with that, but basically subluxation has always been taught as a single bone type deal, and the way that chiropractic biophysics has kind of broadened this horizon is that we look at it segmentally, but we also look at it globally. If someone is shifted over here with their head, we call that a skull translation. What bone's out of place if they're shifted like this? It's the neck, right? I mean, there's several things out of place, but the skull in relation to the thorax is out of position. So that's just not one bone out of place, right? That's a global subluxation. So now, let me show you an example of this. So hopefully everyone can read this from here, right? It says what? Subluxations of the individual vertebra or whole curves, especially those complicated by soft tissue injury. What's that say?
Accelerated degeneration.
Accelerate degeneration. So what does that mean? Accelerate degeneration.
You get nervous.
Yeah, so it breaks down, right? So I like saying it makes you get older faster. All right, so makes you get older faster, leads to disability, and are known causes of morbidity. So there it is. We're not afraid to say it. Okay, abnormal posture and subluxation decreases life expectancy. And I'm going to show some studies in a few slides from now talking about this. So it's more significant than neck pain, headaches, and lower back pain. Okay, and I'm gonna take you through the process so that all of you guys can see this. So this is a normal side view of the neck. This green line is a piece of that ideal spine model. The brain's up here, it continues as the spinal cord. This little canal that I'm drawing with my fingers, it's called the spinal canal. That's where the spinal cord exists. When you have that forward curve in the neck, the spinal cord is in a relaxed position. So the brain can send energy through the spinal cord to all the organs, and then the organs can send that information back to the brain, and that process can happen efficiently, okay? Does this look like a subluxation of one bone or the whole curve? Whole curve, okay? So this is called a cervical kyphosis. Normally in the neck, you're supposed to have a lordosis, a lordotic curve, a forward neck curve. All right, this is good to write down just in case you're ever on Jeopardy or something, right? Okay, so you have the answer. Lordosis in the neck. Now, this is called a kyphosis. Normally a kyphosis is the curve we see in our mid-back. That's that backward curve like this. In the lower back, you also have a lordosis. So you have a lordosis, a kyphosis, and a lordosis. Okay, good. I know it's a weird word, it's a new word, but that's about as technical as I'm going to get with you with fancy words. But basically, in this position, now here's what happens. Remember, the spinal cord's in here, okay? Do you notice how there's a certain height between the skull and the shoulder right here?
That one's elongated.
This one's elongated. There you go. So you're a step ahead of me, but you're right. So now from here to here, can you see how that distance increases?
Yeah.
So the spinal cord really acts like a rubber band. If you take a rubber band and you stretch it, because I like analogies, so I use analogies. If you stretch a rubber band, does it get thicker or thinner? Thinner. Okay, looser or tighter? Okay, so can you see that in this type of neck, the spinal cord will be stretched, it'll be smaller in diameter, and it'll be tight, it'll be under tension. Okay?
It's not relaxed.
It's not relaxed. And if you don't see it yet, just hear me out and take my word, because I'm going to show you in another slide kind of how this really breaks down. Okay, and here's the slide. So this is a study by a researcher named Bragg. And what they did, this is really a neat study. This is a spinal cord. These are spinal nerves. So this is a cadaver where they cut the spine out of the plate. They basically cut the spine out of the way so you could expose the spinal cord. And you could see where the spinal cord connects to the 31 pairs of spinal nerves. They're looking at just the neck in this case. This is, it says slight extension up above. A slight extension means a cervical curve. Okay? So a good forward curve. Now, something else I want to clarify. There's two things that will stretch a spinal cord. A reversal of the curve and a forward head translation. Okay? Can you guys see that if this comes forward and the spinal cord's in the back, that it's going to be stretched tight and tighter the further the head goes forward? Can everyone see that? So now, think about this as normal cervical curve or normal upright posture, where the ear is over the shoulder. These nerves are relaxed. What are these things right here? Those are blood vessels. Okay? So now on the right, that's showing cervical flexion or forward translation or a cervical kyphosis. Can you see what's going on with the spinal cord, with the spinal nerves, which are these guys right here? See, these are exiting in between the bone. You can actually see how much tension there is on those spinal nerves. And then look what's happening to these blood vessels.
They're very small.
They're smaller in diameter, okay? So this study basically led to figuring out that when a spinal cord is pulled tight, it decreases in diameter. The blood vessels inside decrease in diameter. And what it does, they found, I told you I was done throwing out big words, but I lied. It decreases the oxidative phosphorylation of the mitochondria of the neuron, which means that the neuron cannot produce ATP, it can't produce energy, and it can't conduct properly. Okay, so it decreases what's called the evok potential. So in these studies, they send signals down through the spinal cord and they measure it, like in the arm, for example. And they show that when someone has a forward head translation or a reverse cervical curve, that message doesn't go through properly. Is that pretty significant? Right? So now here's kind of a little thought experiment. What if this nerve went down the leg or into the arm or into the stomach? Okay, who here has heard of acid reflux? All right. Everyone seems to have acid reflux nowadays.
Yeah.
All right. Well, I can tell you this. There is a huge correlation between abnormal postural deformities and subluxation in the mid-thoracic spine and acid reflux. One of my first chiropractic patients in Albuquerque was a guy that he had mid-back pain, and I started working on him, and his acid reflux went away, and he was a patient of mine for 10 years, or for about 9 years. 3 months ago, when my wife and I moved here, he helped us pack up our stuff, and he was telling the story again. He said, yeah, I've had acid reflux since you adjusted. He had it for a couple of years prior to that. I've seen hundreds of patients like that. So it's amazing. There's this huge correlation between irritation to a nerve, abnormal function of a nerve, and then the breakdown of organ systems. And so this is kind of a cool explanation as to show why. This is just looking at the neck right here. So now, head and neck posture. This is showing a translation where the head is shifted off to the side. So if you read all that and then you go to the very end, you say it even affects immune dysfunction syndrome, fibromyalgia. Everyone's heard of fibromyalgia? That means like a pain syndrome where you have unexplained pain all over. Well, this is Dr. Herbert Gordon in Seattle Fibromyalgia, and he's showing that these abnormal postures can cause chronic pain. All right, so this is something that I can tell you in traditional chiropractic, and I'm speaking from my own experience because I did traditional chiropractic, adjusting the joints and not doing correction. I did that for years and years. We never looked at skull translations. This is something that is kind of fairly new to this system of chiropractic as far as identifying and fixing this stuff, but it's huge. So now on this one, this is the same picture that we saw earlier. Cervical kyphosis does all this stuff, even causes lower back pain. How do you think that can cause low back pain? Does anyone have any ideas?
Leaning forward.
Okay, it's leaning forward. And let's think about it from a spinal cord standpoint. What's it doing to the spinal cord? It's stretching it, right? So it is stretched from tip to tail. A cervical kyphosis or a forward head translation will stretch the spinal cord all the way into the lower back. So everyone's heard of a herniated disc, right? So a herniated disc is when that disc is bulged out and it's pushed either into the spinal cord or into nerves. So now, what do you think happens if someone has a bulged disc or herniated disc, and now the spinal cord is pulled tight and pulled into that bulged disc? Do you think that's going to cause a problem?
Yeah.
Okay. So a pretty cool study that was done and it was done by our group, is we took patients that had forward head translation like this, okay, and they had lower back pain. We didn't touch the lower back. We just fixed the forward head posture, started to bring it back. And the vast majority of these patients that had lower back pain, the low back pain actually went away by fixing the head and neck posture. The explanation for that is spinal cord tension, is getting tension off the cord. So think about all these surgeries that are being done where someone comes in like this, they have a herniated disc in their lower back because it's confirmed on an MRI, right? They have these symptoms going into their legs, but no one's ever done anything to correct the neck, okay? Does anyone see a problem with that?
Yeah.
Right, it's a big problem. And it's really just understanding the relationship of spinal cord biomechanics. In our seminar system, for example, we teach a whole weekend seminar just on spinal cord biomechanics. It's a pretty interesting seminar. This is what we teach to other doctors. So if you guys ever want to get your brain fried by a lot of information, you can come in here for the spinal cord biomechanics seminar. Listen to Dr. Deeb teach it. It's really, really interesting, but it's very detailed. They've studied all these different forces and how they affect the spinal cord, how different postures affect the spinal cord. So now this is the lower back. This is showing the normal side view of the low back. So this is someone facing this way. It's got a forward curve in it, just like the neck should, right? Now this right here, this is showing an abnormal alignment. We call this stair stepping, where these don't line up. Well, I'll tell you this, when you see this on an x-ray, you can almost predict that on the MRI it's going to show that the discs are actually herniated or bulged, because this is a very, very abnormal alignment. And this is a problem with the whole curve, but also a problem with multiple segments. So now this is an MRI of the same patient. Can you see how that disc is bulging way out right here? This canal right here, that's where the spinal cord runs. Technically, the spinal cord ends at L2, and it continues as what's called the cauda equina, which is a group of nerves that come down here. But basically, that bundle and group of nerves act just like the spinal cord, and when that disc bulges, it compresses right into the nerves and cause some issues. So now, that's what they call a slip disc or a disc herniation. I'm just showing this to kind of tie into what we just talked about as far as tension coming from the cord all the way from the neck. So now, I like to show some cases. This is actually a case of a guy who is a chiropractor. And this is when Dr. Dean and Dr. Shireen had their clinic in Elko, Nevada. And he begged Dr. Dean to say, I want to come out to your clinic, I want you to give me a job, and I want you to teach me how this chiropractic biophysics stuff works, and I want you to fix my back in the process because I'm in horrible pain, I'm almost disabled, and I'm told that I need surgery. So Dr. Deed said, well, we don't really have a position for you. We don't really need you to come out here, but he's a nice guy. So he found a position for the guy, had him come out, and started working on him. This is a series of x-rays. Can you see here? So now this is the person facing this direction. They should have a forward curve in the lower back, and you can see that it's going the wrong way. Can you see that? This is called a lumbar kyphosis. Remember before the neck? It's called a cervical kyphosis. This is rare, okay? You don't see this as often as you do in the neck. The interesting thing about this stuff, everything I've talked about so far, some of these postural distortions, a lot of these postural distortions don't cause any pain at all for a long time. So this guy, he had it for a long time and he was into this severe pain stage of it. But anyway, so he has this lumbar kyphosis, and then can you see how this is starting to change? And it gets back to actually a pretty nice forward curve. So needless to say, he didn't need surgery, and he learned CBP, and he's a practicing chiropractor. How long do you think it took from the far left one to the far right one?
A couple of years.
Okay, so 6 months to a couple years. Well, this case actually took 8 months, okay? But that's not a bad guess, because there are certain cases that do take over a year, okay? But so healing takes time. It's showing that these types of things didn't happen overnight, and it's not an overnight process to correct it. Yes?
What's the chances of it going back to the way it was before?
That's a great question. So the question is, what's the chance of it just regressing back into abnormal posture? Well, that's also something that we've shown in our studies and our research. We've looked at 2-year outcomes of patients that have achieved 80 to 90% of ideal values and then had no care for 2 years. Okay, and what we found is that they maintained a vast majority of the correction, about 90% at a 2-year follow-up with no intervention in between. So the whole challenge is getting someone to the point where you can achieve that 80 to 90% of ideal value to begin with, because at that point, per the research, the structure is strong and it's not just going to collapse under gravity again. But for example, on that guy, if we stopped halfway through and he only got about a 50% correction, then what do you think would happen over time?
Go back.
At that point, it's going to start to go back, because all of us are under the weight of what? Gravity, right? So this is in reference to this case we just looked at. Patients with a relative kyphosis in the lumbar region, so that's essentially what it's called, a lumbar kyphosis, had significantly more rateable disability. Okay, so this is actually a marker for future disability. There's a patient we started here a couple weeks ago. She came in for neck pain and headaches. She had a lumbar kyphosis, no low back pain, 24 years old. And so we basically identified a marker that statistically would put her in a category of future rateable disability. But now we're fixing her lower back as well as fixing her neck, and she doesn't have headaches anymore. mean, that took like 3 visits. And that's also something else I'll just kind of mention, is that her headaches went away before we even started fixing her neck curve. So getting things moving in her spine, affecting the actual segmental subluxation, got rid of symptoms. But was she fixed in 3 visits? You know, if she had a backward neck curve, which I didn't tell you that part, she had a backward neck curve. So in 3 visits, we're not going to fix her. So the problem is that if we stop at 3 visits, that backward neck curve's still in there, and that problem's going to come back. And so she's actually going through a corrective program, and we're fixing the structure. So here's something that I think is worth mentioning. All this stuff I'm telling you about posture and how it affects organ systems and that sort of thing, it's not brand new information. In 1957, a medical doctor named Freeman, he published this in what journal? Can you see what this says?
American Medical Association.
Okay, so
AMA.
this is AMA, so this is a big medical journal. 1957, showing that aging in the spinal disc caused postural deviations. It led to all this stuff: intestinal diverticula, hemorrhoids, varicosities in the legs, osteoporosis, as well as, what's the last thing say?
Hip and foot deformation.
Okay, and then at the very end? Yeah, at the very end, even a shortened lifespan. So this is 1957, so it's not brand new news. It's just that it really hasn't been paid much attention to. It hasn't been addressed. Because unfortunately what happens is we see someone and they have an abnormal posture, and typically we relate this with someone who is getting older, but it's not just in someone that gets older. We see this in you know, young demographics as well. But we see that and we say, oh, that's just part of the aging process.
Yeah.
You know, and oh, too bad. You know, I went to the gym this morning, and as I'm leaving the gym, I see this man with crutches, and he's bent over about this far, okay? And I followed him out to his car, all right, because that's just how I am. And I started talking to him, and I said, sir, you know, I don't want to be out of line, but I couldn't help but notice what's going on with you. We have a system that's very unique and different, and I'd be happy to actually check you out and see if we can help you. This guy actually had polio. He's had 4 back surgeries, but he has nothing done to help him figure out how to stay upright and stabilize his posture. So his condition is progressively worsening. He's only 70 years old. He looks like he's about 90. So his body is aging prematurely because his nerve system and his spine is broken down so significantly. All right, so I told you earlier about this translation type of posture, this trunk translation. And if you watch here, you see this little animation where he shifts over to the side. This is what it looks like on the inside. The spine actually shifts. And the problem is that big, important structure inside the spine, called the spinal cord, if the spine translates and distorts like that, what happens to the spinal cord? It stretches and then has to translate and distort with it, doesn't it? So now this group, this is something that's been studied. They call it the abnormal trunk deformity group. They've shown that it causes all these other issues, but even that these people have a decreased satisfaction with human relationship, satisfaction with economic condition, and even satisfaction with present-day life. So they're showing that these types of trunk translations, they're basically equating that postural deformities, abnormal spine issues, actually decrease overall satisfaction of health and can affect people emotionally. So it's not just a physical issue, it's not just an organ issue and a nerve issue, but emotionally, physically, everything. Isn't that significant? Right? I thought it was interesting. Okay, so for example, after this class today, I expect you guys, when you're in the grocery store and you see someone standing there, and you see someone maybe standing like this with a purse over one shoulder, you might see her and say her posture has great intention behind it, meaning she's not just standing there because her 5-pound purse, okay? But she could be standing like that because she has abnormal trunk deformity. So for example, her x-ray may look like this. She might have just, you know, went to her OBGYN earlier that day to get treated for, you know, cysts in the ovaries or painful menstruation, or went to the orthopedist for sciatica. I'm throwing conditions out there that correlate with this type of translation in the lumbar spine. But basically, something I'm expecting you guys to do is really start analyzing others' postures when you're out at the grocery store or at the airport. This is what I do quite a bit. I was traveling a lot, so I'd sit there and I'd watch a lot of people in the airport, and you notice, you know, a lot of times when someone's standing forward like this, they're also wheeling around oxygen with them. Okay, I'm going to show you a little demo real quick while I'm on that subject. Everyone sit up real straight. Try to align, you know, that normal posture so the ears line up over the shoulder. And what I want you to do is I want you to take a deep breath. Okay, so hopefully that feels good for most of us, right? So now, push the head forward, roll the shoulders forward, keep the head upright though so you're still looking forward, okay? And now take a deep breath.
Can't do it.
All right, you can't take a deep breath, right? What does that feel like?
Claustrophobia.
Yeah, right? Claustrophobia, like someone standing on their chest. So do you think that when someone has a posture like this and they're wheeling oxygen behind them because they have breathing difficulty, do you think that if someone actually identified and taught them to bring the head back and correct the posture, do you think it would help the breathing capacity?
Oh, yeah.
Yeah. Okay, so that's just one example of how posture affects mechanical lung function. Okay, so there's different causes of posture weakness. The main one that we talk about here is physical, but emotional, chemical. Chemical, for example, who here would agree that we live in the most chemically polluted time of the history of this planet right now? Okay, so chemical exposure to different types of, you know, soaps and detergents and I mean, a variety of things actually have a physical effect on our structure, on our posture, on our musculature, on our spines. So there's different causes of subluxation. It's not just getting in a car accident or falling, but all of these other aspects can actually affect spine alignment and nerve system function. So I like this slide. It says how you age is a choice. And it's showing a good upright posture to begin with. And then this is not necessarily just showing as time goes by, but as abnormal posture goes uncorrected, it gets worse. And so this is the stage where someone's wheeling around the oxygen. Okay, so lots and lots of different symptoms associated with postural weaknesses. The most common postural weakness on this list, I'm going to give you a hint because I want to talk about this for a second. What do you guys think is the most common postural weakness?
What does this start with?
Well, if I say that, I'm just going to give it away. How about this? If your head's like this, okay? Actually, you know, here, I want you to come up front real quick. I want to show this little demo because I'd rather you guys answer this. Okay. Okay. So now a normal posture. Okay. Let's represent the skull as it relates to the thorax. Normal posture, ears over the shoulder. I'm going to do a little demo. So put your arms up in front of you just like this. Okay, and put them closer to your body. Let's pretend this is normal posture. I'm pushing down, and you can hold this up. This is him walking all throughout the day, and gravity is pushing down on his head, but he's got good normal posture, and he's a pretty strong guy. So he can hold this up all day long, no problem, not too difficult. Okay, so now let's say you have a forward head translation, okay? And your arms are right here. And now I'm pushing down on this, okay, hold it up. And now gravity, no, hold it up. Okay, no, hold it up. Okay, so basically, as I'm pushing down, this is gravity. What's going to happen 6 hours in the day, 10 hours in the day, 12 hours in the day? You're going to start hurting. It's going to start hurting, and basically, you're not going to be able to hold this up. You're going to fail, right? Okay, I'm going to hurt you. Okay, so basically, I did that demonstration so you can see that mechanically, when the posture is abnormal, and I use this forward head translation as an example, but a skull translation, a trunk translation, a rotation of the pelvis, all these different types of postural abnormalities make the body work much, much harder just to stay upright. So what do you think happens if you have this abnormal posture? Pain is one. Fatigue. Okay, you got it. That was good. See, I didn't give you the answer and we figured it out. That's awesome. So fatigue is the most common symptom that we see with postural distortions. Who here feels like you could have more energy? Okay. All right. Maybe. Yeah. All right. Some of us. But something that I find with a lot of patients that come through here, we talk about, do you have issues with decreased energy? You know, tired, fatigue. And almost everyone says, oh yeah. 2 o'clock comes around, I'm ready to take a nap. And then you start looking at the posture and you see your body is struggling just to stay upright throughout the day. So fatigue is the answer. You got it. Now, I try to make this interesting, so we show some cases. This is actually a patient of mine that I took care of in Albuquerque. He worked in a prison, and he came in after a car accident. He has a surgical fusion in his neck. That's what these little white pieces are. Those are screws in his neck. That was kind of unrelated. He was in a rodeo accident when he was a teenager and broke his neck. But this guy was working as a prison guard, and he was extremely fatigued. He was falling asleep. He worked the night shift. He was falling asleep at night. And also, in looking through his health history, severe constipation. So his gut was not working properly. Okay? Now, normal function of the gut, it varies from person to person, but a good rule of thumb is you should be emptying the colon. Okay? You should be moving the bowels 2 to 3 times a day, at least. Okay? So some of you ask yourself the question, am I going at least 2 to 3 times a day? And if it's less than that, if it's once a day, or if it's once every other day, that is constipation. Now, he also had lower back pain. So he had pain right down here. This is called a posterior thoracic translation. Notice what happens to my pelvis as the thorax moves backwards. Can you identify what's happening?
Yeah, your pelvis gets tilted backwards.
It tilts, right? Okay, so can you see how his tailbone is tilted? It's kind of upright, almost like an ice cream cone. And then can you see right here, it's starting to tilt forward?
Yeah.
Okay, so what we did is we basically translated this forward. And this took 3 months. And the cool thing is his lower back pain actually went away a couple weeks into corrective care. But the cool thing is his whole demeanor changed, his energy levels changed, and his bowel function actually improved. He wasn't constipated anymore. Kind of a cool case. So this one is really cool. This is called a thoracic lateral flexion and a skull translation. This guy had chronic headaches. This was a patient of Dr. Deeds out in Elko, Nevada, several years ago. Can you guys see how this is abnormal? Okay, this is looking at someone from the front, the skull and then the shoulders, right? Okay, and it's kinked off to the side. So now, this guy had chronic headaches. He was about 40 years old, but he also had something else that was pretty significant. He had what's called Tourette syndrome. Does anyone know what Tourette syndrome is? It's where someone swears uncontrollably. Okay, there's a lot of facial tics and twitches and that sort of thing. And typically, it's something that you see that's made fun of in movies and that sort of thing. It's kind of, it's easy to poke fun at. But for these people, it's a very debilitating condition. They don't want to go out in public because they're embarrassed of different outbursts. And there's lots of different facial movement and twitching and that sort of thing. And medically, how do they treat Tourette syndrome?
Psychiatric drugs.
Yeah. So basically, various drugs. And the problem with the drugs is it makes you extremely run down and fatigued, but it also causes sexual dysfunction. So for a guy in his 40s that has Tourette syndrome and now taking this medication causing sexual dysfunction, that's not really going to help with overall satisfaction in life as far as well-being and just functioning as a human, right? So now this guy went through a corrective care program. Not only did his headaches go away, his Tourette syndrome went into remission. He got off of all his medication. And so this is actually a case that Dr. Deed published. So he wrote it up and published it because that's what our group does is you see these cool cases, we don't want to just tell it to a handful of people. You want to publish it so that more of the world can actually see what corrective chiropractic can accomplish once you start fixing these things in the spine. Okay, so the first most common cause of subluxation is the birthing process. I'm going to go through this a little quicker. So they showed that these birthing traumas pulling on the child's head can cause injury to the upper neck. Because in this country, and we're one of a handful of countries that does this, the women are always in what position when they give birth?
Laying down.
Okay, they're laying down, they're face up, and the legs are straddled, right? Why do you think that is?
Make it easy for the doctor.
It's easier for the doctor, okay? So if a doctor is delivering, 20, 30 babies a day, it's easier mechanically for the doctor to see what's going on. I mean, that makes sense. But the best biomechanical position for a woman to give birth in is weight bearing, is upright, okay? Typically like a squatting position. The problem is the doctor can't really assist in that process. So when a woman is laying upright giving birth, a lot of times the doctors want to get the baby out quickly, so what do? They pull on the head, okay? So a piece of advice that we give all of our pregnant mothers is try as much as possible not to let the doctor pull on the baby's head, and you actually inform them about this ahead of time. I mean, unless there's an extreme emergency and it's a matter of life and death, the mother wants to actually do the work and push the baby out so that there isn't a chance for upper cervical trauma. So what happens is they found that a lot of these birthing traumas affect the upper neck primarily. And so some people say, well, you know, I don't have to worry about it because my baby was delivered by C-section. Well, C-section deliveries sometimes, most of the time,
They still do that.
yeah, most of the times aren't really any better than a normal birth, because typically they're trying to make a small incision and they're trying to clear all these different, you know, guts and things to get the baby out, and the first thing they usually grab a hold of is the head, and they're twisting through this tunnel to pull them out. So now this is a cool case. This is actually a 4-year-old little girl that she was hanging upside down on the monkey bars, and she fell off the monkey bars and she landed on her head. So she landed head first into the ground, and for the next couple of months she was getting very sick. She was getting colds and she was getting ear infections, reoccurring ear infections. So her parents took her to the pediatrician, and they were talking about, you know, she did several rounds of antibiotics, and they finally told her she needed to get tubes in her ears. Well, she actually went and saw Dr. Deed out in Elko, Nevada. They found this type of neck curve initially. Can you see how this is a little bit off of normal? This is a very straight cervical curve in a 4-year-old, almost reversed a little bit. And then this is 6 weeks later. And you can see it's not perfect, but can you see how there's now a normal, or at least a forward curvature starting to approximate in there? And that's at 6 weeks. So the interesting thing is, the pediatrician that was giving all the antibiotics and recommending tubes in the ears said it was a spontaneous remission, which is something that we put in there because it's kind of almost laughable. You know, it didn't spontaneously go away. They fixed the curve in the neck, and things started working properly, and the immune system function improved, and the ear infections were no longer an issue. The cool thing about kids, you see this says 6 weeks. Kids respond really quickly, typically about half as much time as going through a game plan for adults. Okay, so let's see if this starts. This is showing a normal cervical curve, and then if you watch it closely, and I don't want to hit it too many times. Here we go. Okay, so this is showing kind of the process of going from a normal cervical curve to losing the curve, and you'll start to see what happens in between the joints. You know, this space right here is the disc. That's the bone. Person's facing this way. And you can start to see what happens to these discs. You can see how they're thinning.
Yeah.
Right? And then the bone starts to do what?
Shift.
It starts to shift and actually do what? Can you see what the bone's doing? It starts to change its shape. And starts to fuse together, right? So now, we typically don't see a lot of patients at this stage in our office. Do you know why?
Because that's really bad.
Because it's really bad and it's not usually compatible with life. Okay, so typically at that point, when there's that much destruction to the actual spine, the spinal cord has to go along for the ride. And unfortunately, the spinal cord is under tons of stress and strain and different loads, and a lot of times there's bone actually pushing back into the cord. So this is a stage that we don't like to see someone at. It's not to say that if someone came in with this type of presentation that we would turn them away, but it's just at this point, it's what's called a limitation of matter, meaning there's not really a ton that can be done to obviously put a normal curve back into this neck. Okay, so let's look at some of the alternatives. There's medical rehab programs, physical therapy types of rehab programs. Sometimes surgeries will cost between $20,000 and $60,000, rarely fully covered on health insurance. Okay, ineffective at completely eliminating pain. Usually the surgical outcomes, unfortunately, for like a lower back surgery, for example, the majority of lower back surgeries at 3 to 5 years post-surgically are either the same or worse. So it's a small percentage that actually get pain relief or improvement. You know, multiple patients that we've seen here that have had back surgeries, usually it's not just one surgery, they've had 2 or 3. And the reason they've had that second or third is not because the first one was successful, right?
Right.
Okay. The problem is, though, it doesn't focus on structural or postural correction. It doesn't address the cause of the problem. You know, if someone has a bulge disc in the lower back and, you know, they have horrible posture and they have a reverse lumbar curve, they'll go in there, they'll cut the disc out, and sometimes they'll even put hardware in the spine and they'll lock it and fuse it in that position. And the problem is that's not going to help anything. It might give a little bit of temporary pain relief, but then as time goes on, the problem's just going to come right back. And it usually starts to actually act higher. So typically, if a joint's fused in the spine, now the next joint up is the next one to work overboard, and then that one's next to get fused. So it'll start at L5S1, that's the most common one, then it'll go up to L4, L5, and there's patients that we've seen that come in and they're fused, you know, from L3, 4, 4, 5, 5S1, and they've had 3 surgeries. You know, there's rods going all up and down. Okay, so here's some questions. Where do you want your health to be in the next 20 to 50 years? Good, okay. You want to be playing with your kids, your grandkids, and be able to function, right? I mean, my answers to these questions is, yeah, I want to feel like I'm not limited by my body. You know, that I can wake up in the morning and not feel like I can't move and I can't face the day, but I can do whatever I want to do. That's my own personal goal. What do you want your activity levels to be like? What's the more, this question right here, there is a correct answer to this. What is the most important aspect of your life? Okay, and some people might say my family and my kids, and yeah, that's all important, but what comes before that?
Your health.
Your health, because if you're not healthy, okay, especially as a family, if one person in that family is not healthy, who does that affect? Everyone in the house, right? All right, so there's 2 types of care that we do here in this office. And there's one type that we're really, really good at and that we like to do. The other one we're good at too, but we prefer the second one. So there's 2 types of care. The first one we call patch-up or relief care. That's where someone comes in and they say, you know what, I have a backward curve in my neck and I have all these postural issues that you've pointed out, but I don't care, I don't want to fix it. I just want pain relief and that's it, and I'll come back when I'm in pain again. And that's something that we will still honor someone's request. We'll make sure that we at least educate them on that. That's not going to give a permanent fix. But typically we can see someone 3 to 5 times a week sometimes until the pain goes away. And it might take anywhere between 10 and 15 visits, right? And so it's showing like a Band-Aid going on the knee. This one over here, this is what? Okay, horrible, right? It's braces on the teeth. So we are like orthodontists of the spine. So it's showing a corrective fix. Now, typically, this is the standard model that we use to take someone through corrective care. This is what our research protocols have shown is the amount of time it takes to justify making enough changes in the spine to then warrant taking a comparative X-ray. So we do comparative X-ray studies. We do comparative postural outcomes. We're looking for objective change when someone goes through a corrective care program. So what does it show? 3 to 4 times per week. So either 9 weeks at 4 times a week, because what's 9 times 4?
36.
Okay. Or 3 times a week for 12 weeks, because what's 3 times 12?
36.
36? Okay, can't wait. All right. So basically it's a 36 visit protocol between 9 to 12 weeks. That's what it takes to actually make structural changes to then warrant taking a comparative X-ray. So it is not an overnight fix. It's something that definitely takes work. It's a combination of things that we do in office and also that we teach someone to actually do at home. So in a second, I'm going to show you how we do this stuff. There's something called a stress test. This is something that in some of the cases is necessary for us to figure out how malleable the spine is, how malleable the structure is, how much it's going to change. So what we do is we actually have someone lay on a piece of traction equipment. There's these things called Denarals. Some of you, I've laid on them here. Some of you are to the point where you have them at home and you're doing them at home. But basically, this is a type of weighted X-ray test where we're stressing and distorting the spine back to normal to see how it's going to react, to kind of predict if it's going to do what we think it's going to do. And it shows us the weakest and most damaged areas of the spine. Okay, so as far as how it's done, the first thing that we have to do is you have to evaluate what's going on with the posture. This is showing the most common posture that we see in this country, which is a forward head translation. And then we're showing a mirror image postural corrective exercise. So we teach someone to move the opposite direction. Usually it's done initially just statically, meaning you're just kind of holding themselves against their own muscle contraction, an isometric contraction. But then eventually, in some cases, we'll have them do this with TheraBand resistance. So actually have them do this exercise against a resistive force. This is showing a mirror image adjustment. Okay, this table is called a drop table, and a drop table actually makes a noise, but it shifts, it drops. The whole purpose of a drop table, this is a question that people ask all the time, and I want to explain it here so you guys understand, is that the purpose of the drop table is not just to actually mechanically shift a region of the spine, but the drop mechanism actually triggers a process called proprioception. It helps reset proprioception. So everyone do this. Take your hand and put it out in front of you, okay? And it's still within your gaze. You can see your hand, right? It's high. Now put it low. Okay, you can still see it out of the corner of your eye. It's low. Now put your arm behind you where you can't see it. Put it high and put it low. Just don't smack your hand on the table, okay? So now, the whole reason I'm going through this is because now I want you to answer a question. How do you know where your hand is positioned when it's behind you if you can't see it?
Muscle memory.
Okay, so muscles. Okay, so basically here's what it is. There's these joint position receptors called mechanoreceptors. They're in multiple joints all over our bodies. Those joint position receptors, they send a signal to the vermis of the cerebellum. So it's part of the brain that controls equilibrium, balance, and posture. So our position in three-dimensional space is this feedback mechanism between mechanoreceptors in our joints and a portion of our brain called the vermis of the cerebellum. All right? So now this drop table adjustment, we're putting someone in a mirror image, and the drop actually stimulates mechanoreceptors, joint receptors. That sends a signal back to the cerebellum, and it resets that whole mechanism. So now, for at least a couple of minutes, up to a couple of hours, and then eventually several days, and then several weeks, someone can get up from that adjustment and will actually see correction immediately. So, for example, someone can come in like this. We can put them through postural corrective adjusting. We can get them fairly level. But the problem is, initially, it's not going to stay that way for very long. Why is that?
Because it's been the opposite way for so long.
It's been the opposite way for so long. So if it's been the opposite way for so long, what things need to be addressed? I'm sorry?
It must have a memory.
Okay, so like neurologically it has a memory, and we're trying to reset that, but what else is involved? If someone's stuck like this, what do you think is going to be the difference in musculature from side to side? Right? It's going to be shortened on one side and lengthened on the other. And then ligaments are actually going to be asymmetrical. Discs are actually going to be conformed to that abnormal position. So this last picture right here is showing traction. And if you look out the window and you see all this type of equipment here, we have this here because to fix the spine, in most cases, requires types of traction. We're actually trying to load and deform tissues into a corrected position. So there's literally thousands of different types of traction that can be done with 30 pieces of equipment that we have here. And so it's not a one-size-fits-all approach. It's all calculated based on the person's posture and their x-ray. So there's different angles and different loads and that sort of thing. Typically someone will sit in traction for about 15 to 20 minutes maximum after we can build them up to that amount. So we start with a small amount of time and a small amount of weight, and then we work someone up as they can actually handle more. Okay, so here's another example. Here's a skull translation where the head shifted off to the side. So the exercise, can you see that we're putting them in a mirror image corrective posture? And then the the mirror image adjustment, and then the traction. Okay, so this is called a Berry translation table. If you look right over there, we have one 3 over right there. We're getting the second one pretty soon too. So, and then after this person will then graduate to now doing standing traction. So there's a couple of units on the other side of this wall where someone can be strapped against a wall and then translated over while they're standing. Because in that standing posture, it's a little more difficult, but you can take someone further and you can actually load ligaments and muscles, and gravity interacts with it. So some of the traction, we start in certain areas and then we graduate someone through as we make more and more change. Okay, so who do we see? From the young at heart, we see families, we see weekend warriors, we see elite athletes. A couple weeks ago was our grand opening here. This is a relatively new clinic. We've been open for about a month. Our grand opening was October 20th. So this guy right here actually came out to our grand opening. He's a guy by the name of Clay Guida. He's basically a very well-known mixed martial arts fighter. He fights in UFC. And then also too, there's another guy here in town. He's the only professional UFC fighter in all of Idaho. His name is Scott Jorgensen. His mom's actually sitting right here. Okay, so and Scott's also a patient here as well, and something that we're going to start with him very soon because he's out of town right now, isn't he? Yeah. So when he gets back in town, we're starting to do some corrective work with him. Remarkably, his spine is actually in pretty good shape. But out in Albuquerque, that was around the largest training camp in the whole country as far as mixed martial arts. It was a school out there called Jackson's. I was a team chiropractor, so I took care of a lot of these guys. So I saw a lot of these top athletes, and a lot of those guys had really, really messed up spines. And we would take them through these corrective protocols, and they would watch their athletic abilities actually improve. They could kick symmetrically. They'd say, oh yeah, I can kick really well with the right, but I can't kick well with the left. And a lot of them had hip rotation and different types of issues with lumbar curves and things like that. So basically, we see all types of different cases here. We even see little babies. Actually, last week I started 2 3-week-old babies. Both of them were diagnosed with acid reflux. And so they were diagnosed with acid reflux, and at 3 weeks old, guess what they were already taking? They were taking a proton pump inhibitor. They were taking Prilosec at 3 weeks old. Okay? So for anyone who knows how Prilosec works, everyone sees the commercials on TV. If you have heartburn, take the little purple pill, Prilosec, right? A proton pump inhibitor, it decreases your stomach's ability to make acid, okay? Acid is in our stomach for a reason. It helps us digest many, many different foods, especially protein, okay? Especially different minerals. So what happens when you have a decrease in acid in your stomach, digestion doesn't work right, and now these people start to have different malabsorption problems, and they start to have different deficiencies. So do you think it's a great idea to take a 3-week-old baby and put them on a proton pump inhibitor? No. Okay, I mean, if it was an extreme emergency, I can understand, but I can tell you this, we've actually taken care of these 2 twins. I've seen them 4 times. We did segmental adjusting, so actually moving segments in the mid-back and their spine. Both of them had an area right in the mid-back. One of them was at T4, one was at T6, so that correlates with the sympathetic nerve supply to the stomach, interestingly enough. But also, both of them had some pretty abnormal postures. So for babies, how you fix posture, it's pretty interesting. You actually put them in a mirror image, and then you stimulate the upper neck, because that's the densest area of joint mechanoreceptors. So there's a little instrument that we have that's like a little sledgehammer almost, but it's very, very gentle, and it goes ta-ta-ta-ta-ta, and it taps. And what it does is it sends that whole feedback loop back to the vermis of the cerebellum. So what we do is we have the parents help us. We put the baby in their mirror image position. So one of these babies, for example, was looking to this way. head was translated, and the pelvis was rotated. Okay? And it's subtle things that if you as the parent didn't know how to look for this, you wouldn't pick it up. And so then what we do is we reverse that posture and we tap the upper neck. And the cool thing with little infants is it's immediate. I mean, and it's a massive correction. You put them back to neutral, you cycle their legs a couple times to kind of get them back to neutral, and now they're looking straight forward, or they're looking the other way. Versus starting off, they will deviate to that side consistently. So the cool thing is I actually saw these 3-week-old twins, they're 4 weeks now, mom today, because she's getting started as a patient here, and she said that after their third adjustment, so they just had their fourth, after the third adjustment, haven't had any problems with acid reflux, or not taking that medication any longer. The whole symptom they were having with the acid reflux is they would feed, and then they would start to kind of hiccup and make different noises, and their pediatrician jumped on the diagnosis of acid reflux. There was no real lab test or endoscopy or anything at that point, which, I mean, I'm not saying to do an endoscopy on an infant, but it just seemed interesting that that was the diagnosis for 2 3-week-old twins, right? So anyway, all right. So there's different things that we do here. We talked about this room on the other side is we have these things called power plates. This is something that we actually tie in and we include in corrective care programs is we include power plate training. A power plate is full body vibration. I'll just kind of throw out the story here briefly because I think it's pretty interesting. Is full body vibration training was actually developed by NASA. We were sending astronauts up into space, and when they're up in space we don't have what force? Gravity, okay? So they'd go up in space and they would have a decrease in bone density and a decrease in muscle mass. And so they'd have to bring them back to planet Earth within a certain amount of time, because if not, they would actually start to break down and get sick. So they're trying to figure out a way to keep astronauts up in space longer, because it's pretty expensive to launch rockets up in space. So what they did is they figured out, they sent these vibration plates up to space, and the astronauts would strap themselves to the plates for several minutes a day, and they found that this actually increased their bone density and muscle mass, and they could stay up in space several times longer. So then that was adopted by the Russian Olympics, and then several years ago, 20, 30, 40 years ago, when the Russian Olympics, the Russians kept beating the US, this is one of the ideas of why they were so dominant. They were training on full body vibration. It was then adopted in the US. It's used in a lot of sports teams, NFL, that sort of thing. But basically what it is, these power plates, it's a full body vibration. It forces your body to compensate and move 20 to 50 times per second while you're training on it. So you can go through certain range of motion exercises. We have these things called TRX bands that hang down from the rafters. So you can do some pretty intense types of training, and it magnifies the effects of the training in fractions of the time. So for example, you can do a 30-minute workout and it's the equivalent of about 2 hours. It's great because when someone doesn't have a lot of time to work out, you can get in with a 30-minute class. So we have classes, we have personal trainers that go through this, and we'll take you through a 30-minute class, and it's all different levels. So they could do one class and they could have someone doing option A, which is the very beginning level, and then they could have someone else who's, a hardcore athlete doing, option D, hanging upside down and doing something a little more interesting. So it's used for training, but we also use it for spine rehab. So there's certain mirror image exercises that we have patients do, and some of them we have them go on the power plate and do it, because now under the force of vibration, it speeds up that corrective process, speeds up the feedback mechanism of the brain, and it speeds up the ability for the muscles and everything to adapt. So a few of the things that we have here, this thing called a Class 4K laser. I believe we're the second clinic in the whole state of Idaho to actually have one of these. It's a pretty advanced type of technology. It penetrates about 3 inches deep. What it does is it promotes blood supply to an area or from an area. There's different treatment protocols. So you can take an injured joint, for example, that has inflammation, and you can actually promote blood flow coming out of that injured joint to decrease inflammation, but it also increases oxygen saturation in that area. So it drastically improves the healing process. Post-surgical cases, different injuries, different disc swelling, joint injuries, sport injuries, things like that. So that's something that we have here as well. There's different products that we promote. We're very careful that if we're going to promote a product, it's something that we've tried and that we actually take on our own. So protein is a huge thing on the market. Whey protein is a huge thing on the market. The purest type of protein that we found is whey protein isolate. It's also the most expensive type of protein. That's why you don't see it in most of the proteins that are out on the shelf. So it's the purest form of protein, has the least amount of digestive difficulties if it's a whey protein isolate. This company actually uses a pure form of whey protein isolate. It doesn't have any added sugar or added preservatives or anything like that. So it's a product that I personally use and we actually promote for our patients because we actually do this type of diet lifestyle called the paleo lifestyle, and it's this kind of funny thing, there's pictures of cavemen and stuff. Well, it's basically talking about eating like our ancestors. Is that we are living in a time right now where we're eating the most processed, refined foods ever. And if you look at the whole timeline, we have just started doing this relatively recently in our existence. And our genetic makeup is not meant to be able to handle a lot of these foods. So this type of diet is great for people that have any sort of autoimmune conditions. There's even been research and testing showing that patients with multiple sclerosis going through and doing a paleo lifestyle actually helps with MS symptoms. We use the paleo lifestyle and different types of proteins for types of weight loss here as well. Okay, I'm speaking to a very fit and trim audience here, but unfortunately in our country there's a lot of individuals who are overweight. And when we go through spinal correction, if someone is overweight, it's going to be very difficult to actually fix their spine. So we address that as well. We want to actually have them lose weight so we can be successful in fixing their spine. And then we use this type of flexible orthotic called a sole support. Everyone here is familiar with orthotics, right? So the difference between a sole support orthotic is that basically your foot should have a certain arch in it. Okay, from stepping and walking on concrete all day, we flatten out our feet, we lose the arch, we stretch that plantar fascia. Okay, has anyone heard of a condition called plantar fasciitis? So plantar fasciitis, the plantar fascia stretches and inflames. So now basically this type of orthotic doesn't just try to put an arch back in the foot, but it's flexible, it's based on someone's body weight, so as they move and they walk, the orthotic actually moves and allows the foot to move how it should mechanically. It's not a fixed, solid type of orthotic like most of them on the market. Also, the way that we cast someone's foot, when we put together an orthotic for them, is we cast the foot in a corrected position. So it's a special casting process. And so it's not just a product that we use, but in our seminars, we actually instruct and teach other doctors on these proper casting procedures. So it's a product that we actually kind of help train other doctors for this specific company. So anyway, that's kind of an overview of the services. And the very last thing, some of you are patients here, some of you are not patients here. There's a little certificate sitting in front of you on the table. It says on the back that it expires on November 2nd, but I believe we expanded that. Yep, okay, so we did. So we expanded that towards the end of November. What this is it's a $250 certificate. That's about the cost that it is for the initial workup, which is a consultation, exam, x-rays, and then the follow-up report of findings. So that whole package thing is about $250. This allows you to do that at our time and at our cost. So if you're interested in getting your spine checked out, if you haven't yet, that's something you can do. Most of you here have been checked, so this is something that if you have a family member or a friend or someone that you can think of based on what we just talked about here that would benefit from getting checked out, you can give them that and they can use it. Okay, so I mean, who here, after sitting through all of this tons of information, who here thinks that they know of someone who might have a problem or might have abnormal posture affecting their health, right? Pretty much everyone raises their hand like 5 times, right? I mean, so everyone was a great audience. I know that this went a little longer than normal. We kind of got off to a late start, but there's so much information in here. Every time I do this, I want to cut it back shorter and shorter, but I figure once I have you guys here as a captive audience, I'm just going to explode all this information onto you so that you can be exposed to all this stuff. So any questions at all?